to us, but I did that whole wound thing. The wound thing is really good. You're going to see a bunch of wounds. There's no two ways about it. So, without further ado, here we are. I'll pick up where we left off and with some additional thoughts. We had finished, if you recall, and again, the wound was a separate unit that I sent you. We finished with prostatitis, and these are when we have sores. Ulceration just means sores. So we have visible evidence most of the time. And the classic disease for this was syphilis. We don't see a lot of chancroid. I wouldn't even ask a question about it. And herpes, certainly. And then the last topic will be warts. And I skipped that in skin, but I'm going to amplify it here. So all of the above are important. Infection with anything that compromises a boundary, whether it's damaging the lining by those drainage disorders or whether there's an open ulceration or not. This is a break in the integrity of the skin or the lining. It dramatically increases the risk of any kind of additional sexually transmitted or even non-sexually transmitted disease. This is famous historically. Syphilis, and interestingly, we'll probably be revisiting this a little bit in A&P, but this is the micro part's a little bit more specific. Been around forever. See, the notion that you could pass diseases by having, intercourse was foreign 1,000 years ago. Why is something that's natural supposed to be, you create these problems? They really didn't understand that. But syphilis is interesting. It is caused by an organism called Treponema pallidum. You'll get to that shortly here. It means the pale thread. It's really why Koch's postulates aren't used, because we can't culture it. It is so fastidious. You can't culture it. It can't grow out on any culture plate, any culture media. It's a microaerophilic gram-negative spirochete like Lyme disease. And the Lyme disease aspect is relevant because it's all about the response of your immune system. A lot of the damage that it does is immunological in nature, but it does a lot of damage, and it was such a terrible disease until we had effectively penicillins, because thankfully it responds very, very well to penicillins. Maybe now we're seeing a little more resistance, but penicillins are cephalosporins, and we're not rid of it, believe me. And I've been noticing this from the articles that I've been reading, that, when HIV reared its ugly head, everybody got very, very cautious. Condoms, monogamous relationships, very careful. And all of a sudden now, again, we get the pervasive idea, hey, if I get something, it can get fixed. Or if I get something, I'll just ignore it. It's going to go away. It's not going to kill me. This is a killer. So it starts with a sore called a canker or chancre. It's spelled CHANCRE. It's typically and the male is fairly obvious. In the female, it can be on the interior, and sometimes it's not as obvious. That's one issue. It's there. That is teeming with these spirochetes. It's highly infectious. The problem is, if it's not noticed or if it's not addressed, okay, it disappears in 2 to 3 weeks. And you know what happens when something goes away like that? People have one thought, I'm better. And the reality is, it's like Lyme disease. You're not better. All it means is that it has gone into your bloodstream and circulating all through your body. And so after a period where it doesn't demonstrate itself, X number of weeks later, all of a sudden you get a rash, you feel lousy, nauseous, sore throats. It's one of these great masqueraders because it's immunological in nature. But at this point, it's seeding all of the interior of your body with these spirochetes. That's secondary syphilis. And guess what? A couple of weeks after it shows up, it goes away. This is not good because, again, out of sight, out of mind. And then it enters what's called a latency period. And about half the people are done. But if they haven't had treatment, there's going to be damage that's ongoing. And about half the people will progress to what's called tertiary syphilis. This is the kind of thing, when it was untreated, this is because the reason they built insane asylums in Victorian England and prior to that was for syphilis, because it went to their brain. And it fostered a kind of insanity. A lot of people think that Jack the Ripper was some member of the royal family, indirect, not a major relative, but some relative of the royal family back in Victorian times who had gone crazy with syphilis, who had some medical knowledge. I mean, there's always a lot of speculation about the Ripper period. So And so the latent periods, we're not talking about a little latent, we're talking 10 years, 20 years, 30 years. It's an extra, and during that time, you're still treatable about halfway through it, but after a certain point in time, it's no longer treatable. Why? But it's still contagious about halfway through it. And then you have run the risk of something called congenital syphilis, which was rampant. We used to have, it would cause, typically it would insert itself into what we call hard tissues. So children were born with noses that were flat, almost. Children were born with irregular eyes, okay, because it would affect, for whatever reason, it would affect the formation of the pupil. I'm trying to remember it went by a particular name. Hutchinson's, it was called Hutchinson's triad. They had notches in their teeth. They had irregular pupils. It was like they had some kind of bony deformity. They had what was called saber shins. The shins would come to a sharp point. Well, it was very, very interesting. And it was rampant. And the late stage changes in the person who had it, not the child who was born, were things they had a funny way of walking like this. It looked a lot like a diabetic. You know, they had, it's almost the inability because, again, the cerebellum was damaged. They had to walk almost in a funny looking way like they were drunk or things like that. It was very, very unusual. And so the spirochete, you can cultivate cultivate's the wrong term. You can visualize in the bloodstream. We did it, by the way, sort of indirectly. We used antibodies, basically did antibody and laboratory tests, sometimes fluorescent tests, to be able, if you did not know, up until, when? Well, it was certainly in 1978 when I first got married. When I got married the first time, you had to have a blood test. I had to have a blood test when I matriculated at Seton Hall University when I transferred from Lehigh University in 71. They wanted to screen for syphilis. It wasn't going to stop you from getting married or stop you from getting into school. That's because they wanted to. It was everywhere. It was rampant. So, I mean, to alert the health department. So when people wanted to get married quickly, they went to either West Virginia or Las Vegas because you didn't have the waiting period. Now we don't. Now the waiting. I don't think that the waiting period exists here in Pennsylvania. It doesn't exist in California. My wife and I got married in 2013, certainly. Okay, so that, I mean, that, when you talk about the blood test, that's what they were testing for, if you did not know that. So largely non-transmissible late in latency and in the tertiary stages. The chancre, painless, that's interesting. If it's internal, sometimes heals spontaneously, no scarring, all better. But the spirochete is in the circulation and it is very, very active. So then after 3 weeks, maybe as much as 6 months, imagine now you don't even know who your partner might have been. Many systems have been invaded, fever, headache. This is that whole, and you can Google pictures of this. I might have some on my other PowerPoint sequence. All of these areas have a lot of spirochetes in them. And your immune system is responding very, very aggressively. So the variable latent period, 20 years or longer, you can, again, the test was for the antibodies, so it was indirect. Thankfully, the antibiotics have made a big deal when people finally did get treated. But by the time they get into that late stage, now you're dealing with a lot of significant problems. Nerve tissue particularly, I think, would be affected. Cardiovascular is part of it. Aorta subject to rupture, valvular damage. And these are the real bit. These are like, they call them gumma. It's like a soft, imagine that you all of a sudden you feel like a soft spongy area and then the bone would start to literally denude, and we would see pictures of these people. It's almost like they had leprosy where they had pieces almost missing. Okay, very, very more impairment of function, but skin, bone, and cartilage. So it was very evident. There was no treatment before antibiotics. So there was really a whole lot that was going on with it. So infection leading to congenital syphilis, can occur at any of the trimesters, critical areas, miscarriages, skin eruptions, bone, nervous system abnormality. Here's the idea: Hutchinson's teeth, the teeth with the notches. Usually you'll see evidence of this. You'll see illustrations of this, and I'll see if I can see it. Again, it's gram negative, so we end up with certain immunological reactions. Human to human, very fastidious, can't survive, very easy to destroy. If they can't survive, I mean, they're very easy for antiseptics and things like that. 36 hours in store blood. Risk of infection from an infected sexual partner, that's very significant. That's a high number. Very high number. Okay. Antibiotics really improved it. Notice they have been increasing. Worldwide, notwithstanding, there's always going to be problems. Okay. And again, because of the barrier being damaged, now you have the co-infection with things like AIDS, et cetera, et cetera. We don't have to go through all the tests or anything. It was called the dark field examination. You can see the spirochetes, little corkscrews that were there. No vaccine currently exists. They used mercury. I was going to mention that. The very first thing that we called, quote, an antibiotic was really an antibacterial. It was called salvarsan. Basically arsenic, which is a poison, but it helped with neurological problems, like nerve disorders. People would get little mini doses of arsenicals. And he experimented with about 600 compounds. And he named this salvarsan, which was salvation by way of arsenic. It was an interesting name. And it was comparatively effective. That was really the first antibacterial. There was a movie about it called Ehrlich's Magic Bullet back in the 40s, which is pretty good. Okay. And I mean, this was toxic. The mercury is highly toxic. People would go inhale mercury vapors. Crazy. Okay. So current recommendations, again, is gram negative. Cipro works. I mean, it's not hard to treat. You just don't see this as much. What happens is the toxin leads to these very large lymph nodes. They ulcerate and in the groin region. They're really disgusting if you see pictures of them. Again, hygiene, uncircumcised men, some asymptomatic carriers. I wanted to get to the ones that we're dealing with. That's why I zipped through it. Not going to be questions. No Haemophilus ducreyi. See, I know the name. You're going to miss me. This is the last time we're going to talk to each other like this. Or next to the last we have. For those attending, how many of you are going to go here, going to the honors presentation? I might have a limited number of people. Herpes is very minor from a standpoint. And other than the first bout with herpes, that's about the one that's most symptomatic. Okay. These can be anywhere. Think of how it's transmitted. They could be anywhere without getting too clear, but they're tiny vesicles filled with fluid. They're blisters. Very irritated. Okay. That's typically the initial one. And sometimes the recurrence is like that. Not very non-specific types of things. It can even be completely asymptomatic. On top of that, the problem is some people are very prone to recurrences. Went into it in antibiotics, the acyclovirs, and the one that's most commonly prescribed is Valtrex, which is valacyclovir, have changed the game for this. Antivirals don't work unless you've been exposed to it. It prevents reinfection, it prevents breakouts, and it basically causes breakouts to be limited. That's the good news. It's not prevention. You don't have an anti-herpetic vaccine for either oral or genital herpes. And genital herpes is generally more painful and severe, but obviously with the variety with frequency of oral sexual activity, one can go to the other fairly easily. So it's not confined anatomically, so to speak. Say some people never get recurrences. Some people have tons of outbreaks. They have tons of recurrences. So they'll keep, and that's the people who will have some type of regimen, on taking, I don't know what the parameters are, but take Valtrex on a regular basis to prevent that. Because my wife very often will get a flare in her trigeminal. We have Valtrex handy. Sometimes if she gets a cold sore, Then all of a sudden, the next thing you know, it'll flare her trigeminal neuralgia. You know, is there an association? Possibly. Maybe it's just an inflammatory response. So I mean, she hasn't used it in a year or two, but we have it sitting there, you know, where we keep the medicines. Every year, 1 or 2 persons per million with chronic herpes diffusion encephalitis. You might, my daughter had the herpetic meningitis. You might remember me talking to you about that early on, in case she had that back. And basically the way it was, and she did well on the acyclovir compounds. Effectively, as the physician explained to her, he said, imagine you were going to get a cold sore here, but it went in instead. And she was fortunate it didn't go into encephalitis, because that would have meant there was brain damage. You know, there was some type of significant damage. Thankfully, the viral is much more eminently treatable than the bacterial. And she had the usual things: headache, stiff neck, etc., etc. Fortunately, it was treated properly. Terrible in the newborn, particularly herpes, general herpes. That first case, or a really active, untreated case, extraordinarily bad. Okay, infants die from that. Okay, so herpetic disease is a newborn. So pregnant women with history of recurrent infection monitored. All of this is extraordinarily important. If it would preclude a vaginal birth. That's what, and again, it's naive to think that everybody seeks prenatal care. They don't. But everybody here, people in your orbit, sure they will. But it's naive to think that. I had a student, maybe I told you, back at CCAC, who had worked for an OBGYN in Fox Chapel. Well, nobody would come in without thinking about having a baby. I said, you know, maybe not in Fox Chapel, but, you know, around the world, you know, there's a lot of poor areas in Pittsburgh as well. You know, I can think of at least 2, if not 3 occasions in the 2 years I was doing emergency room. We had girls who had gained a lot of weight magically, and like 15 or 16 years old, and came in ready to deliver. Dad didn't know anything about it, just had a tummy ache. That stuff happens. So either one of these can lead to it. Obviously, as I was saying, what signifies it, distinguishes it from a skin disease, it starts on mucosal linings like that. So, I mean, in reality, either virus can infect either region depending on type of contact. That's better stated than me struggling to try to explain it. During latency, I mean, I've read authors that suggest that they can transmit the infection. Okay, slow level shedding of virus without a lesion or production. The reality is, and with warts and with herpetic lesions, the fact that you don't see them does not mean they've just started to go away, or they're just starting to come. They could be there. I'm telling you, just take it on that. Lots of things re-trigger it. There's any number of things. It's hard to specify with that. Let me see. 4 billion out of about 7.7 billion people are infected. It means you've had a herpetic virus. You've either had herpes type 1 or herpes type 2. It's pretty hard to avoid. Okay? Direct exposure, secretions, typically active lesions more often than not. Herpes is more common than chlamydia and gonorrhea, but is not a reportable disease because we can't control it. The same thing with HPV, the same thing with trichomonas vaginalis. All of the above. Yeah, avoiding contact. It depends on where the location is. Condoms do provide good protection when they cover the site. Okay. Again, a lot of these, I forgot to mention, with syphilis, even in secondary syphilis, talk about the kissing disease. You can get that from just kissing somebody. It's all throughout their secretions where it's secondary syphilis. If you think I'm trying to frighten you, I am. Not you specifically, Allie. You're just shut up. I've gone this far with this class without getting fired, but it's getting close. It's getting close. Not that close, but close. And obviously, all that type of good stuff. The acyclovirs were very effective. Why? Because it activates the antiviral when it gets into the enzymes from the herpes virus, activate the acyclovir. So that's part of it as well. And I didn't get to talk about warts with skin. The fact is, it's the same wart virus. Okay, human papilloma virus gives, whether it's a plantar wart, a palmar wart, a plain wart, anywhere. Warts on your body are all the same family of viruses. Viruses we do by different types. Okay, there are certain types that are predisposed to create genital herpes, I beg your pardon, genital warts. And within those types, there are even certain ones that are unfortunately highly associated with cervical cancer and penile cancer. There just are. That's the problem. The statistic is alarming. You would see it. Most authors will tell you this is the current statistic. 15 to 30%, as we talked about here before, of all cancers are directly related to viruses. The vast majority of these are HPV. 80%, okay, of cervical cancers are directly related to HPV. And it's a big problem. I mean, it's very, I can't explain it any better than that. In general, it's easy to get. Most little kids get warts. Warts are a contact type of a thing. Things that understand it's a virus that's in the skin and the epidermis only. So basically, something has to help it sort of penetrate or get pushed in. In sexual contact, obviously, it's friction of intercourse. Okay? That's easy to explain. Why we see so many in the bottom of the foot? Imagine kids get them from locker rooms, kids get them from public pools. A lot of times, if you go to public pools or gyms or Ys or any of these places, what they have is they'll have years ago they used to have burlap, which was we wouldn't slip on. Now they have typically those plastic, look kind of like fake grass, and you don't slip on them, but those little points can actually inoculate the skin with wart viruses. It's almost impossible. That's one of the things. So, you should, gyms, shower shoes. If you use a gym here, I mean, again, I don't know what. Do they in that athletic complex now? Do they have shower facilities there as well? Yeah, I'd be using shower shoes. That kind of stuff. It's very easy to transmit. It's not something that causes long-term. I mean, there it's inconvenient. The reality is most warts go away within a year or two. The only reason to treat them is if they hurt, surely. If they are in an area that's a pressure point, which would induce them to hurt, if they appear that they're spreading, or for cosmetic reasons. And I made a lot of money treating warts. I had wart club every afternoon. Kids would come after school, we'd treat them with chemicals, happy dance. There's another office visit. Ding, 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 ding. I think I got a sob when they were making sobs. It was an Audi, driving away a nice car. Should have named it Veruca, which is a fancy name for warts. But that's part of it. What are the common denominators? Not necessarily hygiene. Some people are more prone to it than others. Moist areas predominate. Okay, that's another thing that plays a role with it as well. So here we go with this. Now we're talking about HPV vis-a-vis sexually transmitted. Okay, they are outgrowths. They protrude out. The only reason we see them, they don't grow in. On the bottom of the foot, when you're walking on them, they get pushed in. Other than that, they protrude out. They've had other names. Years ago, we used to call them condyloma acuminata. So I have seen some really bizarre ones over the years. Outgrowth on the tissues of the genitals in the females, in the vulva area, vaginally, in the male, almost anywhere. Okay? And again, anywhere with a frictional nature of physical sexual intercourse, whatever kind of intercourse it is, can produce it. That's there. So here's the condyloma acuminata, and it's kind of flat, and it would almost look like if you were looking at the exterior of a head of cauliflower. Okay, unsightly and obstructive, very significant. And then even these ones, these different types, it will lead to not just the cervix, but again, the very delicate skin of the male external genitalia, unfortunately, behaves similarly. Okay, vast majority is conservative. That's a horrible number. Males can get it from infection with any of these viruses. Again, these are the more common sites. And obviously, particularly with anal intercourse, male to male anal intercourse, very difficult to locate, obviously. Okay, much less common than cervical cancer. The biggest area that we're seeing, okay, right here, we're seeing a major uptick. I mean, and some notable people. If you're familiar with the actor Michael Douglas, who's he had a stage 4, and he openly says that's what caused it. It wasn't, he was being very sort of informative. He had a stage 4 carcinoma that fortunately responded to treatment. Non-enveloped, we know it's naked. Again, years ago, we call it papova. That's papilloma polyoma, vacuolating agent viridae family, if you wanted to just call it HPV. A lot of different types. Okay. It's about the location. Sometimes they're a little tiny. We call them seed warts. Sometimes they're flat. It's all about the location. These are more likely to cause the appearance. Other ones, cervical changes. These are the big players that are there. Almost any of these vaccines will have these, and my understanding is 16 and 18 are the most common. But if you have it or don't have it, that's a matter of choice. That's there. It's my understanding that this has been a relatively uncomplicated agent to use. A lot of parents are reluctant because of, particularly for their children, because I think it's as early as, we used to be 11 to 26. I don't know if that changed, because they think it increases promiscuity. I mean, perhaps it does, but it would be better to have promiscuity than dying of cancer, I guess. Be me. Okay, and this is how it works. Oncogenes, it's the truth. 14% of female college students. I mean, the numbers are staggering. Sexually active adults. That's auto inoculation. That's interesting, but I'm trying to figure that one out again. You're just going to get in trouble if you try to make some clever remark. I'm not going to do it. You can't make me. Okay. And this is the other thing, that whole toilet seat stuff. Okay. Naked virus. That's kind of what they're talking about. Inanimate objects. Remember fomites? This is one of those. Pap smears. And there's adequate treatment that's there. 9 different types of HPV. Okay, as young as 9. Wow. I mentioned, I just recorded a lecture about this to my advanced phys students, because it was part of the repro unit. Unfortunately, this fellow died, but I mean, he was an OBGYN, very big practice. And I asked him about this about 15 years or so ago, maybe more. And he said he immunized had a lot of his patients. He never had a problem with it. So I don't know enough about it. Pretty standard stuff after that. Incurable, it never goes away. Herpes never goes away. HPV never goes away. Once you have it, you have it. Treatment is available, and with the immunization, then it becomes a question if that's something that you or people in your orbit are interested in. Fine, if you feel that's the appropriate treatment. This is an interesting one. It is a pox virus. It's called molluscum contagiosum. My first wife had it. It is, and inevitably, it it's typically it's frictional. Like I said, warts are generally spread by contact. We call them sexually transmitted, but it has some more of the frictional component. So typically and I have seen it not just on her, but in a lot of individuals, upper thigh. Okay, so if you imagine positionally, etc., that type of thing. All we had to do, and I'm sitting there with a dermatologist with her, and and this is when I was a resident, and you just numb them and use an electric needle. Done. Never came back. It's an oddball type of thing. Again, if it's an area and people don't treat them, again, they're compromising a barrier. So they can be transmitted. They call them molluscum because it's like they got a tiny white center. Think of it like a pearl in an oyster. It's where it got its name. And again, it can be transmitted, all those types of things. But if that's an enveloped virus. Actually, that particular one. I've seen it. And the group B, this is unfortunately a different streptococcus. Group B is not the same as Group A. I was reading an article this morning of all times about additional problems they're having with Group A streptococcus, how they're concerned that this is becoming more back to epidemic proportions. We're talking about people not being cautious about strep throats, and they're seeing an uptick in things like rheumatic fever, a few more frequent cases of scarlet fever, etc., that type of stuff. So that was interesting this morning as an aside. But again, during pregnancy, this Group B is different. And again, it has to be identified that preterm delivery, okay, is considered a reproductive tract disease. And we think, I thought there was more to it in this particular one. This may be the source of puerperal sepsis, childbirth fever. So there is, at least that's what we think makes certain people. There's a lot of things that make some women from back days, when babies were delivered by 4. Again, midwives had a very good handle on it, and it took a long time to remember the whole thing was Semmelweis. That's there. Here's the molluscum. I'm going the wrong direction. Okay. That's everything there. Let me see my time. Oh, we got time. Good. Pictures. You're all looking at me like, what the hell? This is the Nestor one. Yeah, I wish they had some more illustrations. Just, again, I'm not doing leptospirosis. And they had the same picture there. That's just showing the toxic shock nugget. You can see that was that whole thing with the tampons. I mean, after that, FDA standardized absorbency. It was all about this high absorbency thing, and then the testing. Okay, it was, again, it was emergent in that regard from effectively what became a convenience tampon, which is very surprising. But I remember the hue and cry. I just started open in practice. A lot of questions about that. So again, now we see it more from people injecting themselves, typically things like anabolic steroids, things like that, where they're not injecting themselves with stuff that is illegal or inappropriate to use, or people who are untrained. The best way to describe it. Just trying. This just gives you the idea. Folks at Dr. Dress, did you do the synthetic epidemic? No. Oh, we did. How many people got infected? It was crazy.
I did in high school.
Yeah, I mean, you see how fast that stuff spreads. I mean, that's what this is talking about. And all the different color cascades, people have a bunch of them. We were a lot less educated about this than we should have been. And there were a lot of people in my generation said this to you before, the whole idea of casual sex, of having one night stands, of the stuff that went on in the late 60s and throughout the 70s, all the way until the advent of AIDS. It was crazy. Don't do that. Chlamydia, I'm trying to think of it. I think we covered most of it. That's typically what the discharge looks like. It's how that could go unnoticed. The word would not be unnoticed. And it suggests, and one of the PowerPoint from the physiology textbook suggests that this is not painful. They have no idea what they're talking about. I mean, it's just awful. But I mean, people have chose to ignore these things, much more so in the male. In the female, a lot of times, these are things that are not easily noticed or discerned. If it's an ulceration, it can be on the interior. The drainage is not necessarily as specific. Okay. Again, this is a gram-negative diplococcus, typically associated with, we typically find it inside of white blood cells. These fimbriae make it very, very easy to adhere to anything. Anything. Again, mycoplasma, yeah, they're part of it. I don't think it's a big, I'm not going to ask a question about that. So, again, mycoplasma and chlamydia are similar in the sense that cell wall antibiotics don't work, Z-Paks and tetracycline work, but we're learning more about this, okay? In the sense that it's almost when we see certain types of drainage and we can't, if it's not trichomonas and it's not gonorrhea, then it's either going to be chlamydia or one of these. And the whole idea, very careful if somebody in a female, particularly if they're pregnant, then you have that whole subset of things that can infect the child. But typically you're going to utilize things again, like the Z-Pak or fibromycin, which is doxycycline. Here's a syphilis. It doesn't do it justice. These, interestingly enough, these chancres or cankers are painless. I know. This is not someone you're going to have anything to do with, if you know what I'm talking about. Here. Don't start. You hear you saunter in here a couple of minutes, fashionably late. Actually, we're on time. And I mean, this is kind of some of the stuff you see with secondary syphilis. Ugh. The rash is particularly palms and soles. Is very. If you look on images, Google images for this stuff, if you want to think of unpleasant things. This is a gamma. They always show this one. I mean, eventually that person's nose is not going to be there. The cartilage is going to denude. They're going to have. In the old days, there was a great show that was on Cinemax before it was made by HBO. It was called The Nick. It was for a hospital around the turn of the last century in New York called the Knickerbocker. And they're showing people with syphilis who would be walking around with like a metal thing on their, to take the place of their nose. The nose wasn't there. It had, I mean, it was rampant. Rampant. Those are those teeth I was talking. That's Hutchinson's teeth, those notches in the teeth that were there. They had the Hutchinson's pupil, this irregular pupil. You would even see that in tertiary syphilis. Historically, a lot of people, Al Capone, the notorious gangster, went crazy. And they were sure he died of syphilis, the complications. He had gotten out, he'd been incarcerated, and finally had gone so crazy they basically ended up spending his days, somewhere in Florida, some type of sanitarium, dying from that. Again, same illustration you saw. The spirochetes that are there. That's that chancroid. These are more painful, but this is that lymph node that's going to open up and drain. Yuck. Sorry. That's the herpetic lesions. That's not unusual at all. Okay. The numbers are staggering. This is about 8 years ago. And 45 million infected U.S. 500,000 cases. Probably there's more now. Scary. Oh, and there are the warts. I know. So you would think people would get these things taken care of. They don't often do. They don't often do. They hear it again. And you can see the numbers, now this was 11, 12. So we're think of the difference over the 8 years they've been. The largest portion of sexually transmitted, the biggest number, middle school. I know. And most of these are orally transmitted, it's oral sex. A lot of misinformation. You can't, the whole thing, you can't get pregnant the first time and blah, 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 all that type of stuff. That's statistically, that's been the big rise, and it's mostly oral, various forms of oral intercourse. Middle schoolers. Just parents to come, have fun. I know. Don't even think about it. Forget about it. Yeah. And then we talked about this already. I really don't have to go through a lot of this. These are all the age-defining illnesses. I mean, if you have HIV positive and any of these things happen, now it's AIDS. Most notably, that was the PCP pneumonia. Yes.
Do people end up, like, when you talk about AIDS-defining diagnoses, do you just need one?
One.
Or, okay. Do people get multiple at the same time?
Oh, yes. Okay. I mean, these types of things, typically when it goes, it gets full-blown. So they'll have candidiasis, they'll have Kaposi's, they'll have the pneumonia. Unfortunately, you get a lot of these things happen, contemporaneously, the best way to describe it. I don't know how accurate the chart is. To me, traditionally the sub-Saharan or equatorial Africa. I mean, I was reading stats that, and it's surprising, there's been a lot of good treatment. They made a lot of treatment available there, which has helped because there are a tremendous amount of people who are infected. There's HIV-1 and there's also HIV-2, but this is, 1 in 20 adults, a big number. But again, a lot of people have lived with this as long as, and the big trouble with this, there's no sore, there's no blister, there's no wart, there's no drainage. I mean, typically, may not be ill. 6 days to 6 weeks, asymptomatic, mild if it's in the acute. Okay, the whole idea of what is called a viral set point is when they first diagnose it, you find out how many viruses are there when it's first diagnosed in the bloodstream, and that's called a set point. And then if treatment lowers it, but it's an indicator of just how likely they are. Some people it's very high by the time it's diagnosed. That's the trouble. And think about trying to track who you got it from or who you have given it to. If it was 3 weeks, depending on how. And I'm telling you, when this first came about, I mean, really, this was, again, that was that era of casual sex that was going on. This friend of ours who was gay, I mean, it was crazy. We go, my wife and I, and he, we're going to go to outside of Philadelphia, called Oxford Valley Mall, nice upscale mall, on the way, out in a nice suburbs in Bucks County. And we go to the mall, and all of a sudden, John was his name. He came up to me, I'm not coming home with you. He went home with somebody else. And then we see him, and he'd come up and knock on the door after his company had left. It's like, that was the kind of thing that occurred. We're like, my ex would turn and go, you're so bad. I mean, we were making light of it, not realizing. So, and a lot of these, and again, AIDS, that helper T cell thing, we talked about it. You can look at that if you want. 2 types, HIV-1, most AIDS cases, HIV-2, less severe types in Africa. And like any other virus, it's primarily an RNA virus that rewrites itself as a DNA virus. They have a tendency to mutate. And there's a certain degree of complexity with this virus as well. Not a whole lot else that you have to know from this. think you're pretty good after this. Pages. So they give you a lot on this. And again, this is something, depending on where you're going career-wise, you may need to know more about this. We could do a course on this. And here's Trichomonas vaginalis. Again, the color of the discharge, maybe a characteristic odor, preterm births, pinpoint hemorrhaging, depending on, and you can see that. That's what it looks like. And that's what causes this twitching, this movement. We characterize them by flagella. Exactly how it does it, it's not clearly understood. It's anaerobic, so you get gas production, easily killed by drying, can survive on moist, obviously your facility to use somebody else's towel or somebody else's washcloth. Again, multiple partners play a big role in this, etc. Metronidazole works very effectively. Voila, we're done. So thank you very much. If you again, I'll be in the office for questions or anything along those lines. So I'm happy to do that with you.